Before we begin, please know that some episodes include language that may be sensitive for some people. Thank you for joining me for another episode of The Birth Portal. My name is Connie. Today's true story is about a woman I'll call Teresa, who was planning a home birth for her third child. This was when I was a student, ready to deliver my first baby with the help of my preceptor midwife. We call this a four-handed catch, as the preceptor's hands are there to guide the student's hands every step of the way. Teresa's first 2 labors and deliveries were fairly straightforward. The first labor was an induction of labor for post-dates at 41 weeks and 3 days with oxytocin, and she had an epidural for pain management. She pushed for almost 2 hours and delivered a healthy 8.5-pound baby, sustaining a second-degree tear. A first-degree tear is when the skin tears, but there is no muscle involved, and often no stitching required of the vagina or perineum. The perineum is the skin between the vagina and the rectum. A second-degree tear is where the skin and muscle tear, and stitching is often required. There are 2 other degrees of tears that require stitching to be done by a doctor. A third-degree tear involves some of the fibers that surround the rectum. So imagine something like 200 threads held together to form a circle or an anus. If some of these threads tear, we call that a third-degree tear. A fourth-degree tear is when the vaginal tear goes downward towards the rectum, and all of the threads or fibers surrounding the anus also tear. Teresa's second birth was in the hospital. It was unmedicated, and her labor was only 3 hours long, and she pushed for about 10 minutes. This being her third baby, we call a wild card in terms of the labor. First labors are whatever they are in length. Second labors, we guesstimate that the labor is often half as long as the first. Third labors are the wild cards. You just never know and can't guess very well the length. At 36 weeks gestational age, we did a home visit for Teresa to drop off supplies, her records, and assess the home in the area where she thinks she wanted to have the baby. We had discussions about emergencies and how they would be handled. We talked about if there was a need for transport to the hospital, who would be there for childcare for the other 2 kids if we ended up going in for any reason. Non-urgent reasons why a decision is made to go to the hospital is most often for pain management, like requesting an epidural. If when the woman's water breaks, and it is green or yellow, and the birth is not happening immediately, it would be recommended to go to the hospital in case the baby had any difficulty breathing. When the fluid is green or yellow, that simply means that the baby has passed stool and it is diluted in the amniotic fluid. The more amniotic fluid there is, the thinner the stool or meconium would be. If when it drains out of the vagina and it's like the consistency of pea soup, it can more likely be a concern for the baby's bronchi or lungs. This is where the suction machine is used, which midwives have as part of their standard equipment. Also, if a woman develops a fever or elevated blood pressure, it would also be recommended to move to the hospital. Also, if the labor was not progressing well, like for example, there's been no change in the cervix after approximately 4 hours, we would be recommending moving into the hospital. These are just some of the non-urgent reasons to change plans. Teresa was ready with a good plan in place. And at 39 weeks and 4 days, she paged in the morning that she had started laboring through the night. And now the contractions were about 6 to 10 minutes apart and moderately strong. There was a little bit of bloody show, and her membranes had not ruptured yet. The midwife and me, the eager and excited student, went to assess her at home. Teresa was in early labor, and we felt the contractions were mild when we palpated her abdomen during a contraction. And after an hour, things didn't intensify, So we made a plan to leave and see other moms and babies at home, and for her to call when things seemed to change and become more intense. We would be no more than 20 minutes away. About 4 hours later, Teresa paged again, feeling things had changed. And when we checked her cervix, there were no changes. And she said she had been out walking in the neighborhood and trying her breast pump to encourage contractions. Using a breast pump stimulates the body to release oxytocin, which causes contractions and can sometimes be helpful to kickstart the body to go into labor. After another hour, we felt that she wasn't quite active yet and reviewed the plan on when to page us to come back to her home. By dinner time, she paged a third time, saying, "This is for real, please come quickly." We arrived about 20 minutes later, and there was no question Teresa was in well-established labor. We went to her bedroom and set up our equipment and called the backup midwife to come as she was already 8 centimeters dilated. Teresa's husband was with the 2 kids, 3 and 5 years old, at the dinner table. About 30 minutes later, Teresa is on her hands and knees on her bed when her water broke. The midwife checked her cervix while in this position and said, "Teresa, you're fully dilated." And she walked to the dresser in the bedroom where she was documenting her findings. I quickly put on a pair of gloves and stood at the edge of the bed behind Teresa. And suddenly, Teresa was hit with such a strong urge to push that the baby is coming so quickly. I say to the midwife, "Come, come," and she turns to see me fumbling to catch this baby that's so slippery. The midwife calmly comes to the bed and tells me to hand the baby to Mum from between her legs. Teresa reaches down and takes her baby, saying, "It's about time, little one," and cradles him gently as the midwife dries him off. We help Teresa lie down and put pads under her and cover them with a warm blanket as Dad and the 2 kids enter the room with wide eyes and big smiles. When I crawled into bed that night, I too had the biggest smile on my face, thinking, "Oh yeah, this is going to be the best job ever." Thank you for joining me for another episode of The Birth Portal.